Hi everybody. I want to tackle a really difficult topic today, and that's how do you find the best plastic surgeon for the procedure you're wanting? This is a really difficult one, and I have several items I want you to consider. I'm going to kind of go in order of what I think priority is, and there's about 7 or 8 points, okay? The first one is making sure your surgeon's board certified plastic surgeon. That means board certified by the American Board of Plastic Surgery. So that does not mean board certified by the American Board of Cosmetic Surgery or board certified by the American Board of Surgery, because that is not plastic surgery. Plastic surgery requires at least 2 to 3 years of additional training on top of others. I'm personally double board certified. That means I did 5 years of general surgery and 2 years of plastic surgery. So double board certification is even better, but at least American Board of Plastic Surgery. The second item is make sure that your plastic surgeon has hospital privileges. So if they don't at least do the procedure at a major hospital, they have privileges to admit you there if needed. So I already talked about in a previous video the safety issues with a surgery center, that I'm not a big believer in them, because if there's a problem during surgery, the nurses actually have to dial 911 to get an ambulance there to transfer you to a hospital. Or if it's after hours, and you have bleeding or other problems related to your surgery, you will then need to be transferred to a major hospital to care for your complications, which cannot be done at the surgery center after hours. So that's really important. Next, everybody can search online and look at pictures. Everybody needs to take a look at the doctor's website and make sure that they have the credentials, and also look to see that they have standardized before and after pictures, several of them, of the procedure you're looking for. So that means if you're looking for a tummy tuck, there needs to be several tummy tuck pictures, and they should be standardized. So what does standardized means? Well, we like to post pictures in the operating room before and after skin removal and things like that. And oftentimes they look great. And look, we know how to dress them up. We know how to make them look good. But there's no substitute for a standardized standing before and after picture with the arms in the same position and the patient in the same pose, okay? Usually that's done with a blue background, a dark blue background. It can be done with a black, but a dark blue is better. The lighting should be the same, etc. That will really give you an idea of the quality of the result, much more than a during surgery picture where we're able to conceal certain things, okay? Or where somebody's taking a selfie, which can be very misleading, okay? Those can be helpful too, but they're not the same as a standardized. When we go to meetings, we present standardized pictures to each other so that we cannot fool each other. So that's really important. Also, make sure your surgeon has a lot of reviews, all right? And that means reviews for the procedure you're wanting. A common thing I'll hear is that, well, my friend referred me because maybe she had a breast augmentation by another doctor, but that doctor does not do tummy tucks or doesn't do skin removal. There's a big difference between weight loss patients who have skin removal versus non-weight loss patients. So make sure that you've got those pictures and reviews for both of those, okay? Along those same lines, if they're doing a lot, they should have a lot of pictures if they're doing a lot of that procedure. So make sure they're doing that procedure regularly. An example I do at least 5 to 10 tummy tucks a month. Okay, other surgeons may do one every 2 to 3 months. So certainly you want somebody who's doing a lot of that procedure and is a specialist in that procedure. Take a look at the operating room times. This is a really big key. Everybody should be getting quotes. It should give you an idea how long the procedure is. If the procedure takes too long, that is a red flag. So what would be an example? For me, a breast augmentation is quoted at 90 minutes. That means it takes about 30 to 45 minutes of putting you to sleep and waking you up, and about 30 to 45 minutes of surgery to do the procedure. A tummy tuck with lipo for me takes about 3 hours. That means about 45 minutes of putting you to sleep, waking you up, and about 2 hours and 15 minutes of surgery time. If it takes more than 4 hours for your doctor to do a tummy tuck with liposuction, that's a red flag. If you're under anesthesia more than 2 hours for a breast augmentation, that's a red flag. If you're doing a lower body lift and it takes more than 6 hours, that's a red flag. All right. If you're under anesthesia for more than 6 or 7 hours, that's a red flag, because that's a safety measure. If there's a higher risk of infections, blood loss, blood clots, all sorts of problems if you're under anesthesia for 6 to 7 hours. What is not okay is to then come back the next day and break it up and do a second surgery in 2 days, because that defeats the whole purpose of recovery. You cannot recoup your blood counts. You cannot decrease your risk of blood clots by doing that, and actually it's almost even worse to do something like that. So that should never be done. Another important item would be access to the surgeon after surgery. How do you get a hold of them? Do they give you your number? Do you have to call an operator? Do you have to wait long time, or do you talk to their partners? Do you end up talking to residents? You should have access to your surgeon after any significant procedure. And that should be easy to do. You should be able to come in right away for a follow-up if needed. You know, if patients have any concerns, they get callbacks from me. Okay. The last point I want to make is if you're considering a significant surgery, and the more significant the surgery, even more important, multiple consultations, a minimum of 2, if not 3, particularly for any major surgery. The more opinions you get, the more information you're going to learn, the more difference you're going to see, the more of an expert you become, and that is very critical. So if you follow those 8 or 9 steps I just mentioned, you'll be guaranteed a great outcome. Thanks.